Immune thrombocytopenic purpura or ITP. Immune thrombocytopenic purpura or ITP. It has two subtypes, acute ITP and chronic ITP. ITP stands for immune thrombocytopenic purpura. Two subtypes, acute ITP and chronic ITP. Chronic ITP, it is an autoimmune disease. In this, we have autoantibody mediated destruction of platelet causing thrombocytopenia. The autoantibodies destroy the platelet causing thrombocytopenia. Autoantibody mediated destruction of platelet causing thrombocytopenia. Age less than 40 years, males are more affected, females are more affected. See, it is a autoimmune disease, so females are more affected. Age less than 40 years, sex, females are more affected. Chronic ITP is of two types, primary or secondary. Primary is idiopathic. Primary or idiopathic, no known risk factors. Primary or idiopathic means there is no known risk factors. Secondary ITP, it is seen with SLE, HIV and CLL. Secondary ITP is seen with SLE, HIV and CLL. Pathogenesis, the autoantibodies, that is IgG, are produced against platelet membrane glycoprotein 2b3a and 1b9. Autoantibodies IgG are produced against the platelet membrane glycoprotein 2b3a and 1b9. The autoantibody coated platelets are phagocytosed and destroyed in spleen. The antibody coated platelets are phagocytosed and destroyed in spleen. Clinical presentations: petechiae, ecchymosis, easy bruising, nosebleeds, gingival bleeding, melena, hematuria, or excessive menstrual flow. Clinical presentations are petechiae, ecchymosis, easy bruising, nosebleed, gingival bleeding, melena, hematuria, and excessive menstrual blood. Clinical presentations are petechiae, ecchymosis, easy bruising, petechiae, ecchymosis, easy bruising, nosebleeds, gingival bleeding, melena, hematuria, and excessive menstrual blood. ठीक है. E for ecchymosis, easy bruising, excess menstrual flow. Ecchymosis, easy bruising, and excessive menstrual flow. Nosebleed, gingival bleeding, melena, hematuria, and petechiae. The clinical presentations are petechiae, ecchymosis, easy bruising. E for ecchymosis, easy bruising, nosebleed, gingival bleeding, melena, hematuria, and excessive menstrual blood. Investigation: CBC shows decreased platelet. Peripheral smear shows thrombocytopenia with large platelets, that is megathrombocytes. Peripheral blood smear shows thrombocytopenia with mega megathrombocyte, that is जो प्लेटलेट्स है वही लार्ज है, that is megathrombocytes. बोन मैरो में मेगा कैरियोसाइट्स होता है. पेरिफेरल ब्लड में मेगा थ्रोम्बोसाइट्स, बोन मैरो में मेगा कैरियोसाइट्स विल बी नॉर्मल और इंक्रीज्ड. पीटी एंड पीटीटी आर नॉर्मल. प्लेटलेट काउंट कम होता है, पीटी और पीटीटी नॉर्मल होता है. And then we can do test for platelet autoantibodies. Complication of ITP is subarachnoid hemorrhage and intracerebral hemorrhage. So ITP stands for immune thrombocytopenic purpura. Subtypes: acute ITP and chronic ITP. Chronic ITP में autoantibody mediated destruction of platelet causing thrombocytopenia. Age less than 40 years. Sex: females are more affected. Types: primary or secondary. Primary is also known as idiopathic. That means it has no known risk factors. No known risk factors for primary or idiopathic ITP. Secondary is seen with SLE, HIV, and CLL. Pathogenesis: autoantibodies are produced against the platelet membrane glycoprotein 2b3a or 1b19. The autoantibody coated platelets are phagocytosed and destroyed in spleen. Clinical presentation: petechiae ecchymosis, easy bruising, excessive menstrual flow, nosebleed, gingival bleeding, melena, hematuria. CBC shows decreased platelet is decreased. Peripheral smear में megathrombocytes, that is large platelets. Thrombocytopenia is there with megathrombocytes. Bone marrow shows normal or increased megakaryocytes. PTT and PT are normal. We can test for platelet autoantibodies. Complications are intracerebral hemorrhage and subarachnoid hemorrhage. Subarachnoid hemorrhage and intracerebral hemorrhage are the complications.